the 12 safety practices are: verify care and order for your patient, do hand hygiene before and after patient care, verify policy procedure for the facility, and then assemble equipment and supplies, use manufacturer's recommendations when using equipment, knock on the patient's door, identify a patient with 2 patient identifiers, note the overall patient or the condition of the patient, explain the procedure and provide for privacy, elevate the bed, don PPE if needed. When finished, lower the bed, put side rails up according to care plan, and place call light in reach of the patient. And step number 12, report any abnormal findings to the charge nurse immediately. So I'm going to do a wound dressing change. So first I'm going to put some gloves on, and I would offer medication for the patient 30 minutes prior if needed. And I'm going to remove the ABD pad and toss it. And then remove these. And then remove the packing. And I'm going to put it in my glove and dispose of it according to the facility policy. Ignore that. And I'm going to put some new gloves on and assess the wound. I'm going to note what kind of wound it is, whether it's surgical or a pressure wound. I'm going to note the color, the tissue. I'm going to note the peri wound, the side of it, or around it. And then I'm going to measure. And you'd measure with whatever your facility does. We're going to use centimeters. So I'm going to measure the length. And this wound is 13 centimeters. And I'm going to measure the width at the widest part of the wound, and it is 3 centimeters. And then I'm going to take a cotton swab and measure the depth of the wound at the deepest part of the wound. And this wound is about 2.5 centimeters deep. And dispose of that. I'm also going to dispose of the measuring tool. And when I measured the depth of the wound, I would know any undermining or tunneling, and I would know any drains that were being used. And now I'm going to put dressing back in the wound. I'm going to get my dressing tray, and I have my gauze, my saline, my sterile gloves, and I already have my tape already cut. So I'm going to open my dressing tray. I'm going to be careful to not cross the sterile field, and I do have a 1-inch margin that I can touch. I'm going to make sure my saline and gauze is intact and within date, and I'm going to open my gauze away from me and toss it in at the least invasive area. And I'll take my saline, put the label in the palm of my hand, and put some saline on the gauze. Then I'm going to put on my sterile gloves. I'm going to open them away from me too. fix this one. Okay. So now I'm ready to clean the wound, and I'm going to get some wet gauze, and I'm going to clean the wound from the cleanest, which is the inside, to the dirtiest, which is the outside. So clean the inside. Left. And now I'm going to pack the wound. So I'm going to get some more wet gauze, and I'm just going to fluff it a little bit. I fluffed it. And I'm just going to pack. I'm going to get my cotton swabs. To help me pack the wound and make sure that none of the gauze is touching the skin that's healing around the wound. And dispose. Now I'm going to get 2 dry pieces of gauze to lay over top of the packing, and I'm going to get my ABD pad to place on top of that, and I have my tape. And mine with my initials, the date, and the time on it. I would just make sure the patient wasn't in any pain and tolerated the dressing change good.